So Chris, thank you so much for joining us. We've already started our conversation in the car. So for those people who don't know, this is Minister Chris Picton, who's the Minister for Mental Health and Wellbeing for South Australia. You're into your third year now?
Yeah, third year. 2.5 years in.
So Chris, first question, what got you into politics?
Good question. So I was interested from, when I was young, and I think it really sort of was a sort of semblance of, desire for fairness and equality and opportunity for people is really what drove me into politics rather than any particular policy. But I think that I always, I was a kid, when the Hawke Keating government was in power, and it was a big sort of, it was quite a significant time of change for Australia. And quite a time of success for progressive politics in Australia as well. And then, as I grew up, I don't want to be too political on this, but John Howard took over, and things shunted in the opposite direction. And so when I was in high school, obviously there was a lot of changes that came in when Howard got elected. And I think what really got my goat up at that time was, we went from what was quite progressive, fairness-based system of kids getting into university to one where full fee-paying places came in. So essentially, if your parents had enough money, you didn't get enough grades, you could find your way to various courses, or whatever. Which really, I think that really rubbed up against me, because my parents, sort of middle class Adelaide, certainly were not people who had spare money around. The ability to get into university and progress myself, which I was keen to do, was obviously on the back of grades and success, rather than parental backing. So that really rubbed me up. And then the other thing that sort of happened around that same time was we saw Pauline Hanson come up to the scene, and I remember going to a few rallies and things, while I was in high school at the time, against what was a very, I would say very clearly racist policy that was being promoted around the time about Asian immigration, etc. And I just was really passionate that we shouldn't have that sort of discrimination in Australia. We had to stop on it. And so I joined the Labor Party when I was 15 years old. I was sort of emboldened and passionate by those sorts of things, and then went to university, and university is always a good hotbed for people who are passionate about these things to get even more involved, and sort of growing from there.
And so you started in federal politics, but then moved across to state?
No, actually, the reverse. So,
right.
So I worked. I first got a job for part-time for a senator for a little bit, which was interesting. And sort of did a bit of research, a bit of speech writing, and things like that. And then I worked for John Hill when he was Environment Minister, and then overnight he became the Health Minister. And environment's a very interesting, really great area that I'm still passionate about. But then suddenly thrust into health, which is by far the busiest, most complex, most full-on politically area of state government. And so I worked for John for 5 years, and became his chief of staff. And it was a time when there was a lot of big health reforms happening at the time. And then I got poached by Nicola Roxon, who's the federal health minister at the time, to go work in Canberra. And so I moved to Canberra for 3.5 years, which I was reticent about moving to Canberra because you sort of hear Canberra's a bit of a dull place, but I sort of didn't actually mind living in Canberra. I was really excited about the prospect of federal politics because I thought this is the place where big things can get done. But I left kind of a bit despondent about federal politics by the end of it, because I saw that, particularly through that Rudd-Gillard period, there was just so much, sniping and undermining and backstabbing, etc., that's left a bit of a bad taste in my mouth. And I actually saw, states can be a place where things can actually just get done.
Yes,
And
yeah.
particularly South Australia, where I think we've got a good track record, particularly on our side of the Parliament, of being collegiate, working together, and you're a lot more in touch with what's going on. Whereas in Canberra, you're a lot more connected with lobbyists and industry groups and things like that. You're really meeting, in health, the clinicians, the patients, the mental health consumers, directly. You're meeting people representing them.
It's much more hands-on in that political sense, isn't it?
Exactly.
Yeah. So fast forward to 3 years ago, and Labour winning the election, and despite the fact that you'd already worked with John Hill, knowing that the health portfolio was a big portfolio, you put your hand up for the health portfolio?
Yeah, why don't it? Putting your hand up is a strong word.
Encouraged.
That's right, exactly. Well, I'd been the shadow health minister, so
there
was sort of no doubt. I think that I was going to be the health minister. And it's funny. Like, I remember on election night, it was obviously this very exuberant night at Adelaide Oval where Peter gave his speech, and then I remember immediately afterwards all of these sort of Labor supporters who were all celebrating, excited, then coming up to me and commiserating and saying, "Oh, I'm sorry, Chris, you've now got to be the health minister." But despite the challenges, I think if you want to do a job like this, you'd much rather have a job where you're in the thick of it. And that's certainly the approach I've taken. While there's always a lot of things happening, and you're sort of having to address the day-to-day things that are happening, trying to do that and work on the long-term improvements at the same time is the key thing that I've tried to do.
Yeah. And within that then, Chris, obviously mental health is one part of a very large portfolio. A lot of the work that you're focusing on now is looking at that longer term strategy, but with some short term interventions put into place to do so. So the development of the new rehabilitation beds, and the way in which we're starting to look at sort of like co-investment across portfolios, so yourself and education, looking around how you put in mental health clinicians within schools, etc. Are there other priority areas that you'd love to be able to get your hands into, or to sort of shape from a mental health perspective?
Yeah, well, I think it's a real time of mental health distress, unfortunately, in the community. And I think that takes a number of different levels. At the real pointy end, people who have some really complex diagnosed mental health conditions, particularly schizophrenia, etc. We see that pressure on the acute end of the system. We see people, getting stuck in our emergency departments because we haven't got enough back of house capacity to be able to properly care for their needs. We see problems for them in how they interact with the NDIS system, etc. So that's a complexity, and then sort of obviously connected to that, there's been a number of concerns around the country in terms of people who have committed violent acts as well. But it's significant. It's very important, but it's a small number of people who, in the broader mental health category, all of us have mental health that we need to look after. And I think, particularly in the past few years, we've seen the well-being of the community at large in terms of their mental health. I think, in my view, has taken a step down. COVID hasn't helped that. I think issues like social media haven't helped that as well, in terms of how we relate as humans has all changed very rapidly. And so you've got to do a few things at the same time. We need to do more in terms of the acute end of the system, people who need that help. That's important for them. It's important for the broader health system as well. And you mentioned rehabilitation beds. I think that's critical, because there's a bit of a revolving door for some of those people. They get into hospital, short period of time, not enough time to get better, and then they're back out, and then they don't get better, and then they come back in again. So having, where we're putting in more capacity, we're trying to do it with a longer period where people will be able to stay in hospital and get better treatment. But there is a broader issue of mental health in the community, and obviously that's where your work and Breakthrough's work is so important. And what I really am worried about is kids.
Yep.
So I think that we're seeing it in our schools. I think that we're seeing it in our families. The number one growth of areas of presentations to public hospitals anywhere across the country is not, our ageing population having hip fractures. It is young people with mental health conditions going to paediatric emergency departments.
Yeah.
Everywhere, that's a huge growth that we're seeing. So we're trying to tackle in a number of fronts. One, obviously, in terms of the hospital system. Secondly, in terms of our CAM services, putting more effort and resources and staff into there. But also working with education, as you say, in having more mental health teams working in our schools as well. But then I think the other element of it is what can we do to prevent that from occurring in the first place? And that's where the work that Peter as the Premier is leading, that's really nation, if not world leading on social media is going to be really important too.
Yeah, I mean the social media piece is very interesting, isn't it? Because there's a range of complexities. You go for a carte blanche ruling? Do you look at a phased approach? How do you monitor and how do you control? I think there's some interesting work taking place in the mental health world that's looking at it, because there's competing conversations, aren't there? And obviously everyone's objective is to make it as safe as environment as possible and reduce the risk. Children's very interesting. It's obviously from a Breakthrough perspective, it's one of our sort of themes of investments, and the development of the Big Talks program with Flinders University is starting to have some really positive impacts. I think the latest research showed that there was a 25% reduction in bullying in all the schools that have actually been rolled out in. A few weeks ago, I was very fortunate to join the chief psychiatrist and we went to the APY lands.
Yeah, great.
And we were starting to have some of the conversations with the schools there in relation to if you were to develop a Aboriginal specific children's program and utilising the Big Talk sort of framework, what might some of those stories be? And it's really interesting when you look at for a young person in the API Islands, what is the trauma, the grief, the loss is a very different narrative than it might be from a metropolitan conversation. But what was beautiful to see was the drive and the passion for for wanting to support their community from their teachers, from their Anunga co-development officers as well, which are absolutely beautiful. And these children who are saying, I love this character, but it's not quite like me.
Yeah.
How can I make it like me?
Yeah.
And so I think there is some great work to actually further develop there. If you had Peter came to you with an open check look, in the mental health world, what might be some of those other things you'd love to look at? If you're really looking at that further forward strategic focus.
Oh, look, there's no doubt that there's more that we need to do in a whole range of different fronts. And one of the frustrations is that a lot of the needs connect with what we call in the sort of insider world the primary care space.
Yes. Yeah.
And one of the frustrations that you have as the state minister, going back to the sort of previous discussion, is what's the interaction between the federal government and the state government. And the vast majority of people who are getting their help are sort of going to the primary care system to do so, but they're finding issues in accessing it.
Yep. GPs,
there's not enough of them, overburdened, and the same for psychologists and the same for psychiatrists. So what we need is more workforce to address that, and there's some fundamental structural issues with Medicare as well that need to be addressed to do so. So we're trying to work with the federal government to do so. How we unlock that pipeline of staff is critical. We're doing some things that will enable us to recruit more people like yourself from the UK who want to come here and do so, because we're competing with countries like Canada who are hot to trot as well. But as well as that, we've got a pipeline of our own staff, our own future workers that we need to unlock as well. Like, there's a huge number of people go into doing a psychology degree in Australia, but only a teeny tiny number of them become psychologists. Because of the way that the pathway is structured. there's a huge amount of undergraduate places and a tiny little percentage of postgraduate places. So trying to unlock that, allow for those training places, because there's too many people I meet who say it's too hard to get a psychologist, too hard to get a psychiatrist as well. We're doing planning work with the College of Psychiatrists at the moment as well about how we can unlock additional training places to make more psychiatrists, even though we've got more psychiatrists per capita here than a lot of other states. It's really hard, even in the private system, to be able to find a psychiatrist. So those workforce issues, I think, are the missing element that we need to address.
Yeah, that's good. That's good, because it is that challenge, isn't it? You can build as many beds or as many structures, but if we actually can't get the quality staff in there, you can't get the research that sits behind it, embeds it, and then it doesn't actually drive the change you want it to, does it?
Exactly. And I think, this is not the only thing that needs to happen. I think, there's other workforce models that we're working to expand as well. I think, we're seeing a greater use of peer support workers, peer workforce in mental health that can play an important role, and places like the Urgent Mental Health Care Centre have used them well, where people can feel reassured and heard and listened to when they're speaking to somebody who's been in their shoes. As opposed to somebody in a white coat who feels a bit remote from their experience. So I think there's a multidisciplinary approach that needs to happen. I think the other key thing is we as a system need to listen more to people who have got lived experience in mental health conditions as well. And one of the things I've put in place since we came to office was ongoing funding for LELN, which is the Lived Experience Leadership and Advocacy Network, which represents and stands up and empowers people with lived experience in South Australia. Because a lot of the time you're having these conversations and doing this planning, everyone will be represented. There'll be psychologists represented, doctors represented, nurses represented. But actually we've got to listen to the people who use those
Use the service, of course. And the investment into Leyland has been quite a pivotal change there, and not just from a South Australian perspective, but from a national perspective. Some of the work that they're now leading and driving is causing an enormous sort of shift. Maybe not as fast as they'd like it to be, but it is having such a positive impact, and I think they'd be very grateful for the acknowledgement of the investments that's taken place there.
Well, and I think the good thing is we're now seeing Mark Butler working to set up something similar at a federal level as well. It needs to be listened to in every policy discussion that's happening.
So Chris, suicide prevention is also one of your passionate areas, isn't it? And wanting to drive a change in that area. We have the Suicide Prevention Council, and your colleague Nadia Clancy is doing a beautiful job and continue to advocate and drive that. When we had the Mates Meals and mental health event, the government were wonderful in supporting us with a grant for 100,000 to put towards that fellowship. We actually did the interviews last week. We'll have an announcement coming very soon, which is very exciting. What else would you like to sort of look at within there? There's obviously it's a complex area. It has a range of different focus that you would like to look at. Are there some specifics that are important to you?
In terms of suicide prevention, Well, I think the research is important, because I think if we're honest, I don't think anyone has, properly said, "Oh, I've got the answer in terms of suicide prevention." It's just such a, I'm sure all of us have had some experience with family or friends who've been impacted by suicide, and it's just, you couldn't imagine anything worse to go through. So I think further research is critical. I think one thing that we've put in place in the last couple of years has been registry, where previously to that, the data that was coming out was years and years delayed. And that made it hard to be able to identify trends or hotspots or issues in terms of methods that we needed to focus on. So now we've got a lot more, real-time information in terms of where we need to focus our efforts. I think there's a lot of organisations such as yours that are doing more in terms of community awareness, but I think that the issue of men is important. And obviously, that was the topic that we had that dinner on, and that's what that funding is going towards. And I think one thing that I came into the job with the presumption, as I think a lot of people do, that the issue is just that men don't engage with services. And I think to some extent that's true, but I think certainly some of the evidence I've heard from some of the experts is that actually there's a lot of men who do engage, but don't find that those services engage back.
Yes.
Don't find that it's sort of a welcoming space, and or that they're designed for men and around a particular type of way that men communicate, which is different to women. So I think that there's more that we need to do to better provide a safe space for men to be able to engage with those services, rather than come to a service, feel like this is not for me, and then be disengaged, and then sadly we see some awful results of that.
Yeah, I think that's very true, because the latest data is showing that men are reaching out and wanting to have the conversations, but maybe the reaction they get, or the connection or disconnection, forms the next block or the next barrier for them. One of the activities at the event was the Step to the Line, which has everybody taking part, standing opposite somebody and sharing some of their own personal experiences in life without using a word, because it's about stepping forward. How did you find that activity? Because
look,
I'm sure there were two people in that group that no one wanted to stand next to. I was one, and I got a feeling you might have been the other by default, Chris.
Yeah, well, that's true. I was probably more. Grant Stevens was there. I'm not sure anyone wanted to stand up. I thought it was really good, and I think probably like a lot of people there, to begin with, you're a bit sceptical as to what is this all about, but I thought it was quite powerful. And you're right. I think the person who I was opposite, who I think I don't think he was entirely wild about doing it in front of the health minister, but I think we had quite a good connection by the end of it, and his messaged and connected on LinkedIn, etc. afterwards. So
he said to me, because I was chatting, saying, I felt sorry for it was opposite, and he said, I was opposite Chris. And I said, right, and he said, but he made me feel really relaxed because he stepped forward very quickly, so thank you for that, because it's an activity that is about, you can join in as much or as little as you want to, but it's very powerful when 600 men all came in for a hug at the end, isn't it? And the conversations then just really built up.
Yeah, well, and I think it's yet another sign of we have to reduce the stigma. We can't have a society where people feel like they can't be open about issues that they're faced. And if people are really honest, no one's ever 100% their mental health 100% of the time. People always go up and down, and there's different, you can describe it as sadness or loneliness or apathy or whatever the word is, but I think that's a really good opportunity for people to be honest, and it's only through sort of being open about that not only can that help individuals, but I think it can sort of help broader society as well.
And it is interesting because we found, that's the event we did, we've done 30 of these across South Australia, and that activity has so much impact. That's the thing that people talk about afterwards. That's the thing that people then say gets the conversation starting, because they have dropped that guard a little bit, and it's powerful that's what we still need to do. We need to make it safe for people to have to talk around a whole range of complexities, not necessarily have the answers, but at least then be able to signpost, to connect, and to validate what's really happening for somebody.
And I think for people to not feel alone, because it's only them that something's happened to. That's not the case at all.
Yeah, very much so. So Chris, we did mention earlier about how we look after our own well-being. You've got a portfolio that is one of the biggest portfolios.
The biggest.
The biggest. I reckon the Premier is probably looking at it. It's probably not far off each other.
Wow.
So how do you look after your well-being during that? So how do you get the balance?
Yeah, look, it's a good question, and I have to try to look after myself a bit as well, because particularly having this job, which is, you know, a third of the state government, you know, 49,000 employees. It's just, it's huge.
Yes.
There's something happening every moment, every day, all the time. And trying to balance that with, you know, having little kids, and, you know, occasionally seeing my wife as well. You know, it's a juggle. It's a juggle. So I've really this year been trying to make a little bit more space for, you know, as we talked about before, you know, getting back into running and exercise and seeing the positive benefits, not only physically but mentally, that as well. Trying to sort of, you know, this sort of what people have been talking a bit about recently in terms of, you know, disconnecting, trying to find a little bit of space where at, you know, 2 o'clock in the morning I'm not entirely switched on to what's going on at every emergency department at every time, and understanding that we have other people on who are managing that at a nightly basis. So all of those things, just trying to make sure that, you know, trying to manage not completely getting into burnout, etc. as well. But it's, you know, it's not only a busy job, but it's a job where you cop a bit of incoming as well.
Yes,
and that's difficult, and I'd be lying if I said that, you know, you never read a social media comment or, you know, or a, you know, comment from in Parliament or the media, or even, you know, we had, you know, in fact a mental health organisation that put some ads in the paper that were, you know, pretty personally attacking on me as well. So all of those things, you know, they do have an impact, and you've got to juggle that with, you know, understanding that to some extent, you know, that's just the environment that you're in. It doesn't, you know, all of those arrows don't represent you as a person necessarily. But yeah, it's and also balance it with the good in the job as well, and, you know, the difference you can see when, you know, we've put something in place that means that, you know, people can get an ambulance service, or people can get a mental health service, or people can get an outpatient service where they couldn't previously, and that's really rewarding,
so
and helps.
You have to take the wins as well, don't you?
Exactly.
Yeah. So Chris, the car conversations are based on carpool karaoke. Not going to get you to sing unless you wanted to, but no one ever has so far. But when you are driving home or being driven home, and you've got that time to yourself and you belt a song out, what's your go-to song?
Well, I thought you might ask that, so I was thinking, we're trying to get the kids to listen to, you know, better songs than just, you know, the Wiggles and stuff like that, and so Connie was very clever and got them onto Bohemian Rhapsody by Queen.
Right.
So we've been belting that out in the car.
Good song.
Doing a bit of the headbanging at the appropriate moments, and the kids have been loving that as well. So I'll put that down.
You go with that, right? We'll write
I won't
that
sing
down.
it though.
We'll write it down for the next time we actually have a karaoke and get you up for it.
Exactly.
So thank you for making the time to join us today. Appreciate how busy your portfolio is, but I really appreciate the information.
And thank you for all the things that you do. It's great to work with you, and, you know, it's furthered this really important cause for our state.
That's great. Thanks, Chris.
Thank you.
Thank you.